A number of citizens could lose their health coverage after Colorado Health Op was shut down by the state due to financial issues. According to the Denver Post, the decision could impact nearly 83,000 members. The nonprofit is now suing to regain the right to sell policies in 2016. David, what do you make of this topic?
It's not the only place that's happened. Same thing in Oregon, Kentucky, New York, Nevada, Louisiana. These Obamacare nonprofit health co-ops sold insurance at a much lower price than the market rate. So of course lots of people signed up for it, and their business plan was that other insurers who had a mix of healthier customers who were profit centers for the insurance companies, that money would be taken from them and given to the co-ops. Except it turns out there was less money available for that, and so now the co-ops are financially unsustainable because the whole Obamacare is financially unsustainable. We could have done something straightforward like Lyndon Johnson would have done, which is say we want to give more health insurance to people who can't afford it. So let's raise taxes or cut spending or borrow more money from the Chinese or whatever and pay for it and do that as a straightforward thing. But instead we have this Rube Goldberg thing that is that, what I just described, but in a way that tries to deceitfully hide it from the American public and essentially says, young, healthy people, we will make you buy extremely overpriced health insurance so you can subsidize older people with health problems. And it turns out that there's not enough suckers out there to buy insurance which costs 2 or 3 times what its actuarial value is in the health insurance coverage that these people get. And so the co-ops are going under, and Obamacare is on its way to going under. But to a degree, that was part of the plan anyway. As Barney Frank said, just a transition to government-run, government control of all your health and a single-payer system.
83,000 people sounds like a lot of people to me. Maybe not so much in the grand scheme of things. Natasha, what do you make of this?
It is a lot of people. It's, you know, about the size of Longmont. That's how many people will be looking for new insurance plans come November 1st, which is when open enrollment happens. One of the things that for me, whenever I have this conversation about the Affordable Care Act is super incredibly important is that it impacts so many people's lives in different ways. And in the media, we aren't always good about talking about those individual stories. And I have to say that in my own job, in my reporting, Affordable Care Act comes up like the weather does. It's the type of things that people talk about and they say, oh, well, my son who doesn't have a job after graduation has insurance, and they talk about that because he broke his leg while he was skiing at Vail and, you know, whatever else. Or they talk about somebody who was able to go in for a preventative health care measure and was able to find something early and take those preventative care measures instead of dealing with a long-term illness. So as we have these discussions, I just always try to think back to those sort of private or work-related conversations that I'm having about how this impacts people on a really small level, because 83,000 Coloradans are now facing the question of, okay, what do I do as of November 1st?
Now, we know that the Affordable Care Act and Obamacare is not a perfect system, but it is an alternative to what we had before. What do you make of this topic?
It's just more political nonsense. Even that name, Affordable Care Act, it's really not affordable. It's expensive as can be. We were promised that it would save us $2,500 a year as families. That's, I imagine, not what you're being told as you walk around Colorado. The parade of horribles have just begun. You know, all those exceptions and exemptions, they were delayed to kick in 2016. I think everybody realizes that Obamacare really can't work. People can't afford it. And the plan is to turn it into universal health care. And the only people who might object is the big insurance companies who are part of this Rube Goldberg schemes. They were cut in on it. They've been supporting it. They've been making lots of money. But what is their role once we go to universal health care? I think this is just the start of a snowball that's rolling, and Hillary, in their mind, would be the perfect person to then have Hillary Care, which will be more a form of universal health care.
Hillary Care. I haven't heard that one yet. Patty, can you wrap this up for us?
Well, I got a call from one of those 83,000 people who'd lost their health care on Saturday morning, right after this announcement came down, before the last hope of having a judge let them continue and ended on Monday. And it's not easy. I mean, there are so many programs you have to look at if you call up and try to get this affordable care program. If you've got a family, if you've got a previous condition. The thing is, even though you are able to be covered now with that previous condition, it doesn't make it easy to get the health care. So it would have been nice for these 83,000 people to have a little bit of warning, because they are scrambling now. And there are not a lot of programs out there that are really attractive. There are a lot of programs, but there are not a lot that look good, especially to families that have some challenges.